Meth lab busts like this one in Tulsa County are very common in Oklahoma.
It's common. We average, would you say, 1 a day at least. Sometimes 2 and 3 in a day, and then maybe 2 days with nothing, but on average at least 1 a day.
A simple chemical test by a drug task force agent shows that the product found is crystal meth.
If it turns blue, as you can see it's doing already, that's a positive test.
And this dangerous drug can be made anywhere. Amy SLEMAKER knew something was going on next door, but she never suspected a meth lab.
Not at all. Nope, it could happen anywhere, I guess.
She thinks it should be harder for criminals to buy the ingredients to make this drug, and Representative Lucky LAMONS agrees. In fact, he plans on introducing legislation next session that would require a prescription from a doctor to purchase all drugs that contain pseudoephedrine.
You have to have a prescription to buy the tablets. You can still get the liquid form, you can still get the gel caps, but I think in order for public safety, that we need to look at limiting how those are sold.
LAMONS says the idea is based on an Oregon law that has proved to be successful in cracking down on meth production. And many of the drugstores are in favor of restricting access to that key ingredient for meth production.
Well, yeah, we are, because when we see people coming in and they're purchasing the products, we can generally tell by the frequency that they're coming into our stores that they are involved in illicit drug activity. But yet we're only allowed to do so much to restrict that activity.
You can buy a lot of the ingredients to make meth at your neighborhood drugstore. For customers who are not interested in making meth and don't have health insurance, this new rule could prove to be a hardship.
Really bad, because you gotta waste more money when you don't got no insurance. And it's more expensive for us because we don't got no money for the hospital, for our bills.
But there are others who would rather have the inconvenience of going to the doctor for allergies than to have meth labs in their neighborhoods.
I think it's a good deal. I mean, because people are making too much drugs on it, you know. I mean, there's nothing, they make methamphetamines out of it, and we're just tired of it.
To help him craft the legislation, Representative LAMONS is planning a meeting in October with several different members of law enforcement and pharmaceutical representatives. In Tulsa, Angela Rose-Kranz, the Oklahoma News Report.